Shaheen, so a question for you, if possible. If someone's diagnosed with complex endometriosis, what sort of treatment would they need to have?
So endometriosis can affect multiple organs, and that's what the challenge of endometriosis surgery is. So if the person with endometriosis affecting their bowel, their ureter, the bladder, requires surgery, then that needs to be done by what we call a multidisciplinary team, meaning different specialties joining forces to form a surgical team to do an operation together. And that is why that the British Society of Gynaecological Endoscopy has set up endometriosis centers, which means that there are accredited centers, accredited hospitals in the country that have that setup, have that structure where different specialties can work together. There is a gynecologist with a special interest and training in treatment of endometriosis, and then they work together with a bowel surgeon, with a urologist, with a radiologist, with a pain specialist, and together they form a group. And if surgery is required, as we said earlier, the gold standard is believed to be removal of the disease, excision of the disease. And if the disease has gone into the bowel, then it will be removal of that part of diseased bowel. If endometriosis has affected the bladder, it may require removal of part of the bladder. And these sound scary and concerning, and these are complex procedures, but if done by an experienced team that can work well together, the outcomes can be very good, and that has been demonstrated by a publication by a team from the British Society of Gynaecological Endoscopy to show that women do get better, and significantly so, if treated in endometriosis centers.